Good evening and a very warm welcome to another episode of the Print's Virus Decode. I am Mohana Basu, and on Virus Decode, we get experts to answer all of your questions about COVID and the pandemic. The Maharashtra government has decided to reopen all schools in the state from Monday, January 24th, with Chief Minister Uddhav Thackeray giving a go-ahead to reopen schools for pre-nursery students and students of class 1 to 12. So why did the state government take this decision, despite the fact that Maharashtra is still reporting a high number of cases? To discuss this, we have with us today Mr. Raju Tadvi, BMC Education Officer, along with Dilip Mavlankar, I'm so sorry, Director of the Indian Institute of Public Health, Gandhinagar. We also have Purva Chitnis, the Principal Correspondent from Mumbai for ThePrint. Thank you all for joining us, and I would like our viewers to please drop your questions in the comment section, and I'll try to take up as many as possible through the course of this episode. But before we go to the audience questions, I have a question for you, Mr. Tadvi. What was the thought behind the decision?
मैडम ऐसा है कि जब थर्ड लहर की बात हो रही थी बॉम्बे में, तब पहले दिन जब हमने काउंट किया तो तकरीबन 20,000 तक हमारे मुंबई सिटी में केसेस आए थे। उसके बाद में ये कम होना चालू हुआ और आप देखिए तो 2 साल हो गए हैं, बच्चे घर पे ही है। फिजिकली कुछ उनको वर्क करने का कोई मौका नहीं मिल रहा है। 2 साल से बच्चे ऑनलाइन पढ़ाई करते हैं, तो स्क्रीन जो उनके सामने है, ये बहुत ही आगे आने वाले दिनों में इसकी कुछ प्रॉब्लम्स आ सकती है। और आज के डेट में हमारे बीएमसी के क्षेत्र में 5,500 काउंट आया है जो इसका है, लेकिन हॉस्पिटलाइज होना ये कम है। ये एक बेसिक चीज। दूसरा ये है कि बच्चों में ये दिक्कत, ये बच्चों में ये परेशानी ये 2 साल में कभी बॉम्बे को नहीं आई है और बच्चे 2 साल से घर पे ही है। तो हमको ये स्कूल, जैसा महाराष्ट्र गवर्नमेंट, हमारे सम्माननीय उद्धव जी ठाकरे सीएम साहब ने जो डिसीजन लिया, तो उस हिसाब से बीएमसी ने भी डिसीजन लिया कि हम मंडे से 24 जनवरी से स्कूल स्टार्ट करने वाले हैं।
Right. So basically, the harms that sitting in front of a screen for almost 2 years now is basically something that is of concern, and it has been talked about a lot throughout the pandemic by experts about how much the students and children are losing out by not attending schools. Dr. Mavlankar, from the health perspective, is it now safe to send children back to school? I know that a lot of parents are really worried about the health aspects of it.
Yeah, I think it is obvious that parents will be worried given the news and the data. But as we have been telling as public health officers and professionals and also pediatricians, the infection does happen in children, but it is milder. So that is the first thing to understand, that children get very mild disease, corona disease. The reason being their biology, they have much less receptors for this virus. So even if virus enters, they develop mild disease and get well very soon out of that. So the morbidity or serious disease and mortality in children is very, very less. Of course, parents will be definitely worried, but as Raju sir said, that the impact of schools being closed and running online on children's education has been very massive, and everybody in the world is worried about it. And that is why sooner or later we have to open the schools. Second is, many times we take a view of a state, Maharashtra as a whole. But if you take the big cities, the transmission is more. Smaller towns, the numbers are much lesser. And within those smaller towns, if you see how many children came out to be positive, that will be even much lower. Of course, now the teachers are also vaccinated. School staff is also vaccinated. So the chance from that to children is also less. And I'm sure they have proper protocol of distancing and using of the mask, so that the risk, of course, will be there, but much, much minimal risk.
Right, right. We will come to the question of what are the kind of precautions that the schools in Mumbai will be taking. But before that, Purva, if I can come to you, what has been the reaction of parents? What are you hearing from parents on this decision? How comfortable do they feel sending their children back to school?
Well, if we talk about parents, Mona, then one thing that the Education Minister Varsha Gaikwad, when she gave a statement why she's opening, like announcing this opening of school, what she said is that they received a lot of feedback from parents across the state saying that they need their children to go to school now, not the physical school and not just the online version of it. Now, what I have in my reporting and in the last 2 years got a sense on ground is that since schools are always the first to close in any kind of wave and the last to open always, during that time, like the parents are quite divided here. Because if we talk about the city parents, especially from Mumbai, from Pune, the parents feel that, okay, I have a comfort of home. I have maybe 2 or 3 smartphones. I can give one to my kid, and the kid can comfortably at the home's comfort can learn. But then there is another section, in fact, even in Mumbai, where there is a marginalized section economically, and as well as there are other communities in Maharashtra where who do not have this luxury of smartphone online education, and they feel that their kids are losing out. In fact, on a tribal level, if we go even deeper in tribal section of Maharashtra, what the parents told me is that the kids who are maybe in second standard or third standard or even first standard in 2019, in these last 2 years, they even forgotten how to read or write. Now, that is the extent or the cost of the pandemic that we are sensing on the education sector. So there's a quite divided opinion. Parents who feel that they can afford an online education definitely want their kids to be at home because they are of course concerned about the health over education. But then there is another set of parents who feel that no, I think education is something that they are losing out, and the kids are just playing and not even knowing how to read or write, and they have forgotten about the studies. So they need the physical classes to begin.
Right, absolutely, Purva. We are aware about how much of a difference this privilege brings to children in cities, where not only can parents provide more devices, they also can provide better support in terms of education. Also, I mean, an uneducated parent's child in a rural setting is at a lot of disadvantage in these kind of formats of teaching. Mr. Tarvi, I would like to come back to you, taking from what Dr. Mavlankar said about, provided that there are protocols. So what are the kind of safeguards that are in place to ensure that, COVID appropriate behaviors are maintained in schools?
सॉरी, जैसा कि डॉक्टर साहब ने बताया, एक्चुअली ये जो समय है, ये जो टाइम है स्कूल ओपन करने के लिए, ये सबसे अच्छा था। 2 साल में हमने बहुत सारा प्रिकॉशन लेना, बहुत सारा सीख लिया, जो बच्चों तक भी मालूम हो गया कि हमको किस तरह से प्रिकॉशन लेना है। ये बात। दूसरी बात, जो हमारे स्कूल बिल्डिंग्स है बीएमसी की या और भी जो भी है, तो हम लोग उसको एक दिन पहले जैसे कि सैनिटाइज करके लेना, थर्मल गन हमने लेके रखा हुआ है, हर एक बच्चों का टेम्परेचर चेक किया जाता है। बच्चों को एक बेंच पे एक बच्चा ही बैठेगा, सिटिंग अरेंजमेंट ऐसी करी हुई है कि एक बेंच पर एक बच्चा बैठेगा, एक बेंच छोड़ के बैठेगा। और उनका जो स्कूल आवर्स है वो 2 या 3 आवर्स का रखा है कि बच्चे कम से कम घर से निकल के स्कूल में आए, क्योंकि घर में बच्चे 2 साल से रह के बहुत सारे डिफरेंट टाइप पेरेंट्स के जो ओपिनियन वो आए हैं, लेकिन बच्चे घर पे 2 साल से रहेंगे तो ये कुछ अच्छी बात भी नहीं है। और हम लोग इस समय बच्चों की अच्छी तरह से जो भी प्रिकॉशन लेना है वो ले सकते हैं कि पूरी तरह से हम तैयार है, तो क्यों ना हम स्कूल स्टार्ट करें। और बच्चे फिजिकली मेंटली, बच्चे घर पे वन वे कम्युनिकेशन से ही ऑनलाइन से पढ़ते, बच्चा एक दूसरे फ्रेंड से बात नहीं कर सकता। तो ये जो एक प्रकार का हम ऑलराउंड डेवलपमेंट बोलते हैं या भावनिक विकास जो बच्चों का होता है, उस पर गहरा असर पड़ सकता है। इसलिए स्कूल हमने चालू करा है और इस तरह से हम लोग उसका प्रिकॉशन ले रहे हैं कि स्कूल बिल्डिंग पर डे सैनिटाइज होगी, एक बेंच पे एक बच्चा बैठेगा, 2 या 3 आवर्स के लिए स्कूल चालू रहेगा। बच्चे स्कूल में टिफिन कैरी नहीं करेंगे, पानी का बोतल ओनली कैरी करेंगे, तो एक दूसरे से मिलजुलना भी नहीं होगा, लेकिन बच्चे स्कूल में आएंगे और घर जाएंगे।
Sir, I have a question from a viewer, which I'll ask you, Mr. Tadwe. He's saying that Maharashtra government is not realizing that they're putting children at risk for whom vaccination plan is not yet announced. A section of these people feel that this is a political decision. So, was it a political decision?
नहीं नहीं मैडम, ये बात नहीं है। बच्चों को रिस्क में डालना तो कोई इश्यू नहीं है। 2 साल से हमने देखा है, जो ऑब्जर्वेशन है हमारा, जैसे कि डॉक्टर साहब ने बताया कि बच्चों का इम्यूनिटी पावर बहुत ज्यादा है। एक भी बच्चा बीएमसी में मैंने नहीं देखा कि किसी को हॉस्पिटलाइज किया गया। ऑल ओवर इंडिया भी मुझे नहीं मालूम है कि बच्चों को हॉस्पिटलाइज किया गया। उनकी इम्यूनिटी पावर्स ज्यादा है। और बच्चों को जब 2 चुके हैं कि हमको किस पेरेंट्स को बच्चों को अवेयरनेस दे। जो बच्चे के पेरेंट्स कंसेंट देंगे बच्चों को स्कूल में भेजना, उनको स्कूल में हम पढ़ाएंगे। और जो बच्चे के पेरेंट्स ने कंसेंट नहीं दिया है उनको हम ऑनलाइन पढ़ाएंगे। तो ये जो ऑप्शन है सबके लिए फ्री रखा हुआ है। तो किसी भी बच्चों को डेंजर जोन में डालना, रिस्क में डालना हम नहीं करने वाले हैं।
Right. So basically, the option of continuing online school is available with with the students whose parents don't want them to go to schools right now, is what Mr. Darby is saying, and he's it isn't a political decision. Dr. Mavlankar, this is a question I have from as a science reporter. I have been hearing two different kinds of things. First of all, we say that there is a low risk of disease among children, and also there is still a risk of transmission among children. On the other hand, we know now that vaccines don't reduce the risk of transmission, but they do reduce the risk of severe COVID. So how relevant are vaccines then for children when the risk of severe disease is already not there with them?
Yeah. So I think this is a very important question, and that is why governments are sort of taking step by step and not starting vaccination of the children. Second, immediately is that the vaccines are not tested well in children. So we have to, because any preventive action like vaccination, we have to be very sure that the benefit is much more than the risk. And that is where this issue comes. If the risk is less, why we should do the vaccination? But still, the risk of transmission is there. And to prevent the disease getting transmitted from children to elderly in the home, this may be a good thing to do, to have children's vaccination. Second is, it will also provide peace of mind to the parents who are always worried for their children. If they are vaccinated, then they will feel, okay, that child is whatever best protection we can give. It is not 100% child will get infected, but even if he get infected, it will be milder. So that is the logic. The other fact I wanted to tell when Raju sir was telling is that in last June, July, ICMR had done a national survey of the antibodies in populations. And the national figure was 69%, 67% had already developed antibodies after the second wave in last year, June, July. And within that, children, I think it was about 11 or 12-year children to 18-year-old children, they had 55% antibodies by then. So that is where already many children had got infected, even though they did not develop disease, and had already the antibody. Of course, antibody wane. So what was the number in June, July may not be there, and new serosurveillance has not been done. So other possibility is to do new serosurveillance among children to see how many children are already immune. And right, especially with this virus, which is spreading very rapidly, many people will get the immunity from natural infection.
Right, absolutely. So, there is that is in fact another question that a viewer has sent. Can't school children act as carriers and spread it faster? Which is, I think, what you addressed here. We do have at this point managed to vaccinate quite a huge population of the adult, a huge percentage of the adult population in India. So I think these are some things that we will have to start moving forward with, because we can't afford to keep schools shut any longer. Purva, just moving away from the talk of schools in general, what is the situation in Maharashtra now? How has it been different compared to the past two waves? How has this wave been different?
Well, in fact, if we talk about waves, then we've seen that first wave or second wave or even the third wave, Maharashtra has always been, unfortunately, at the forefront of it. Like too many cases coming out of Maharashtra all the time in all the three waves, and this time also it's not different. But what the experts from different cities and the government officials from different cities tell me is that this time around, as with Omicron and the third wave, the hospitalizations are quite low. Like also the fact that during the second wave, when we saw how Maharashtra spiraled out completely with infrastructure falling short of. Post the second wave, like probably from July and August, what the officials claim, they ramped up their infrastructure quite a bit in terms of oxygen or even the beds, the number of beds, the number of oxygenated beds or ventilator beds. The infrastructure is in place, thinking that the third wave, in the anticipation that the third wave might require a lot of hospitalizations. Fortunately, right now the hospitalizations is low, but the number of cases is quite high. In fact, in third wave, Mumbai saw a high of around 25,000 daily cases at one point of time. Now that has dropped down to as low as 5,000 as of yesterday. So the peak that in Mumbai that we have seen is that the cases went up, shot up from December, last week of December until say mid-January, and now they started coming down. Now, is it because the testing has gotten affected in the sense that since the testing guidelines have also changed, where only symptomatic patients are to be tested? So is that the reason why we are seeing in Mumbai the cases are low? That is a key. That is something that maybe in few weeks we'll be able to say. But as far as the other cities in Mumbai is concerned, Pune and Nagpur, they still are to reach their peak, and the cases are spiraling out. And as far as rural Maharashtra is concerned, well, rural Maharashtra is also now catching up as they aren't catching up to the city level, but yes, the cases are coming out of rural Maharashtra as well. So something that the government officials are probably looking at, and they probably must be looking at, but they need to be very cautious here because the cases are coming out in large numbers. And going forward, if you're not vaccinated, that is something the officials have told me, a lot of officials have told me, that the hospitalization percentages of those who are not vaccinated or are incompletely vaccinated. So that is something that the officials say that we are emphasizing on and making an awareness that vaccination is key, because your severity is going to reduce if you're vaccinated.
Right. Mr. Tadwe, I want to come back to you. When you said, talked about the protocols that are in place for ensuring, that the children do not infect each other. But I want to point out something here. As children, it's very difficult to monitor their behavior in school. If you tell me, if you tell a 6-year-old or any child to stay away, sit away from their best friend, maybe the next thing they're going to do is lick the same ice cream together. So, how will how will the school authorities monitor these kind of things?
यस मैम, जब जैसे कि हम लोगों ने इसके लिए क्या किया है कि टीचर्स को तो पहले हमने यही बोला है कि जब बच्चे स्कूल में आएंगे तो उनसे जो बात करनी है वो एकदम फ्रेंडली बात करनी है। उनको कोई सिलेबस नहीं पढ़ाएंगे, कोई बुक्स नहीं पढ़ाएंगे, कुछ भी नहीं। आपका दिन, आप कैसे थे, कैसा हो गया आपका ये जो पीरियड है, ये है, मतलब जैसे कि एक 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 ये है एक्टिविटी, उसकी जो जो भी स्टोरी रहेगी या जो कुछ काम रहेगा तो उससे हेल्दी डिस्कशन रहेगा, एक 15 दिन, एक महीना भर के लिए, क्योंकि ये 2 साल तक बच्चे नहीं रहे हैं। और एक्चुअल में बच्चों, बहुत सारे बच्चे के पेरेंट्स का भी कंप्लेंट आता था कि हमारे बच्चे डिप्रेशन में चले जाएंगे, तो ये स्कूल आप जल्दी से स्टार्ट करिए। ऐसे बहुत सारे केसेस हमारे सामने आई हैं। तो पहले तो हम उनको 1 महीने तक का हमने ऐसे स्पेशल ट्रेनिंग ऑल टीचर्स को दिया हुआ है कि हमको किस तरह से उनको ट्रीट करना है। और हमने मेंटल हेल्थ रिलेटेड भी कुछ एनजीओज, जैसे कि एक निर्जा बिरला एनजीओ है, उन्होंने हमको एक काउंसलर के जरिए हमको हमारे सब टीचर्स को ट्रेनिंग दिया कि बच्चे जब आएंगे तो उनका बिहेवियर कैसा रहेगा, उनसे कैसी बात करनी है। तो ये सब चीजें हमने पहले से तैयार करके रखा हुआ है। और जो आपने लास्ट टाइम जो मुझे क्वेश्चन किया था कि बच्चों की सेफ्टी के लिए आपने कैसा है, तो बॉम्बे के हमारे जो म्युनिसिपल कमिश्नर है इकबाल सिंह चहल, उनका जो प्लानिंग था, हम इंडिया में सबसे ज्यादा बॉम्बे के लोगों का वैक्सीनेशन हो गया है। 1 करोड़ तक हमारा वैक्सीनेशन पूरा डन हो गया है। तो ये चीज भी हमने अच्छी तरह से संभाल के रखी हुई है कि सब वैक्सीनेटेड यहाँ पर है, स्टाफ है, जो समाज में लोग रहने वाले 1 करोड़ तक हम लोग चले गए। तो बॉम्बे का ये हमारा एक अच्छा प्लानिंग था। और बच्चों से जो बात करनी है, उनको जो पढ़ाना है, उनकी जो भी व्यवस्था रहेगी, तो उसके लिए भी हमने पहले से ही ये बात हमको मालूम थी, हमने तैयारी करके रखी है।
Right. Dr. Mavlankar, if you, would address this question of what do you think parents can do, or how can parents play a role in explaining to their kids about what precautions they need to take and why it is important? Some advice to parents who will be sending their children back to school.
Yeah, I think very good question. What parents need to know, as I said, that the risks to the children are very low. Second is they must also emphasize on the children that what are the ways they can prevent infection. And that is where there are 2-3 main things which we have been talking about, like maintaining distance, maintaining mask as much as possible. And third is for school authorities to ensure that ventilated rooms. Bombay is not such a cold place, so you can keep the windows, the doors open so that there is ventilation, then the risk reduces. The fourth thing I must say to the parents, that if the child is not well, if the child has cough, cold, even slight fever, then don't send the child to the school for at least 4 or 5 days, because child may get infection from anywhere, playing outside or from home, from their parents, because their father, mother may be working and they can bring infection. So if the child is not well, the child should not go, so that the spread in the school becomes less. Of course, the temperature measurement, etc., can be also done at home, how the child feels, and mothers are very closely watching the child. So if there is nasal discharge or child nose is stuffy, because fever comes little later, so even with those things, they can say that don't go to the school, wait for 2-3 days, and then if you improve. The final thing I want to add, which is not emphasized in all this discussion, and now more and more evidence is coming up, that if the vitamin D status of the child is maintained, even adults, they will have much better immunity. So I would even suggest to Raju sir is that if the children can do exercise in the sunlight every day for half an hour, it will build their vitamin D status, and it will also protect. So as a protective measure, sunlight based exposure or exposure to sunlight during the school hours would be very good advice to prevent this disease and many other respiratory diseases also. If your vitamin D level is high, you have much better protection.
Right. I think you raised a very important point there with, parents should be careful and not send their children to school if, it's even if they think it's just a cold or, just a little bit of fever, which is a practice in India. I mean, we do tend to ignore small symptoms like this, but right now we do have to be very careful about that. I think we need to wrap up this session, but before we do that, Purva, I just want to come to you with, can you go over what are the guidelines for parents here? Do all the students have to necessarily come back to school? Is attendance compulsory, or do they continue to stream the classes for those who choose to not come?
Well, in fact, Mr. Tadvi went over those guidelines while he was discussing. But just to sum it up, as Mr. Tadvi was also saying that the school attendance is going to be based on parents' preference. So if a parent doesn't want to send the child to the school, then he will not give a consent form, and that child can continue the online education. So the hybrid model is still there, where an online will be continuing as well as the physical classes will be there as well. As far as the classes are concerned, well, alternate days students will be called, so the strength is reduced to half, and also one child on one bench is something that is mandatory. And of course, not bringing your own water bottle, tiffin, and not eating or drinking in the school premises from a common area. You have to be seated where you have to be. Then of course, sanitization of the school every day is something that they will go over. Checking the temperature at the entrance, that is something is which is there in the guidelines. Then as our experts were also saying, that for parents, if you see your child with some symptom, or if you think that child is not keeping well, then you shouldn't send the child to the school. So that is something from a parent's side, to check whether they have any red eye or any kind of symptom like a sore throat or runny nose. So that is from the parent's side. So all these guidelines are there. And as one important point that Mr. Tadvi was also mentioning was about, initially to begin with, the teachers are instructed to not just go over the syllabus to start off with, just to get themselves acquainted, to the students to get acquainted to the school and the school area. This is especially for those young small kids, because there are kids who have probably not seen the school at all. So what is the school? Get acquainted to the school environment, to and that is also one of the guidelines that is mentioned in the state government's guidelines, that they have handed it over to the BMC as well.
Right. Thank you so much once again, Purva, for summarizing that. This does seem to be like a point in our education system that might usher in a whole new era, where we see children having the access of their classrooms even when they are sick, or even when they are at home or unable to go to school for some reason. And at the same time, this is a very something that parents have been waiting for a long time. It's been 2 years that the education system has been disrupted, and it's high time, according to experts, that children go back to school. Thank you all of you, for joining us today, for giving us your time, and for answering all my questions with so much patience. And thank you, viewers, for joining in and for sending your questions. Every day at 6 p.m. we are here with Virus Decode and with experts who answer your questions. We will be back now on Monday. Have a safe weekend. Do make sure you maintain all the COVID protocols. Keep yourself masked when you're outside. Get yourself vaccinated if you have not yet. And do keep monitoring yourself for symptoms of the disease. Thank you once again.